Hi viewers, I'm Gayatri, working as an assistant professor, the Department of Psychology at Dr. Reshanas Rajalakshmi College of Arts and Science. Today my case study is attention deficit and hyperactivity disorder. ADHD is one of the most common neurodevelopmental disorder of childhood. So it is usually first diagnosis in children and lasts into adulthood. The children with ADHD may have trouble in paying attention, controlling impulse behavior, may act without thinking about what the results will be, so or be overly active. According to recent studies, 1 out of 5 children suffer from some sort of mental disorder. This is a pretty amazing statistics, 20% of our children. Mental disorders are serious deviations from expected cognitive, emotion, and social development. In addition to having mental disorders during children, which may continue into adulthood, these children are also more likely to be diagnosed with chronic conditions such as diabetes. So, mental health is a real issue that deserves real attention. Early detections can lead to early treatment and hopefully reduce the severity of the symptoms. Here are several symptoms in children which can indicate the presence of ADHD. Have a hard time paying attention and listening in class or something. A daydream a lot. Not seem to listen. Be easily distracting from school work or play. Forget things many times. Be in constant motions or unstable to stay seated. Squirm and visit. Talk too much more, not able to play quickly, and act and speak without any thinking, have trouble taking turns, interrupt to others. While the causes of ADHD are not currently known, there is evidence to support the following may be contributed some causes: genetic related causes and brain injuries, environmental exposures, alcohol to tobacco use during pregnancy, premature delivery, low birth weight is one of the reasons to affect the disorder of ADHD. Then diagnosis. One of the issues with the diagnosis of this conditions is there isn't a single test to diagnosis. It is a multi-step process. The symptoms may be similar to this attributed to other mental illnesses such as anxiety and depression. So therefore, treatment can be tricky. Diagnosis more and elimination of other disorders to arrive at the ADHD are the most probable. The process currently used to diagnose ADHD involve the medical exam, so which include hearing and vision, and the checklist. So for rating symptoms and taking the history of the child from parent, teachers, and the child. The treatment, there is no one treatment that is prescribed for each child diagnosis with ADHD. In general, treatment involves a combinations of medications and behavior therapy. The key to treatment is a good follow-up plan to monitor progress and make sure the treatment working according to the plan. And some are ADHD facts and theories. ADHD is more prevalent in boys than girls. Those who have ADHD as a child are more likely to be obsessed as adults. Obesity can lead to issues such as diabetes and heart attacks. This links comes from impulsivity and poor planning and difficulty to making decisions. This is also one of the reasons to influence the ADHD. And ADHD has been linked to issues with drug and alcohol uses during pregnancy. So those with ADHD are less likely to pursue post-high school education. So those with ADHD may be more likely to become adjusted. The children's ADHD have been linked to higher unemployment rates and poorer work productivity. ADHD is tied to lower socioeconomic status on the average. So ADHD is certainly most major concern. It is also a disease which is difficult to diagnose, and diagnosis comes from eliminating or ruling out of other diseases or disorders to diagnosis as the most probable mental illnesses. The symptoms are similar to other disorders such as anxiety and depressions. The treatment are based upon the individuals, that isn't it one cure fits all. So these issues make ADHD difficult to diagnose, therefore difficult to quantify and measures also. Thank you for watching.